When I was young, I'll tell you a little personal story about this. When I was young, I had really bad pain from my jaw joints. Patients will call that TMJ. And it was almost debilitating. No one could figure out why or what was going on. But through a friend, I got linked up with a dentist that was very talented at treating this. And that was my first exposure to dentistry doing more than just maybe a teeth cleaning or fixing a tooth. And I was amazed at how much this changed my life. I'd even had my jaw lock and I wasn't able to eat anything. But with proper treatment, in my case, using a little oral orthotic, which is kind of like a little thing you stick in your mouth that changes the way that you bite, we can start addressing the types of problems that are coming from the jaw joint or maybe grinding. Many times when we see teeth grinding, we first start with treatment like that, and then depending on how severe the grinding's been, we also then turn our attention to how to repair the damage from that grinding, because teeth cannot hold up under that amount of force. They just crack and break and file themselves right down.